Hi everyone, my name is Rachel and this presentation is on reduced compliance with public health guidelines, susceptibility to misinformation on COVID-19 vaccine hesitancy based on social media. These are my fellow group mates Christina and Jakob. So, allow me to share with you a little short introduction on the topic. The COVID-19 pandemic has severely impacted the ongoing health programs, curative services and achievement of SDG 3, which includes good health and well-being. It has transformed health system priorities, leaving it not only overloaded but also limited in its ability to deliver services that it previously extended to communities. This includes children, women, the elderly with non-communicable diseases, and those with special needs. According to Besh and Shahs, users of Web 2.0 applications, which include social media and online discussions, include consumers seeking information on particular vaccine, public health communicators, and active local vaccine groups. World Health Organization Director General Dr. Tedros Adhanom Ghebreyesus stated hesitancy in the midst of COVID-19 outbreak is going through an infodemic due to the misinformation on social media platforms. Moreover, Antonio Guterres, the UN Secretary General, also referred the outbreak as his enemy on March 28 with his tweet stating, "Our common enemy is COVID-19, but our enemy is also infodemic of misinformation" on his personal Twitter account. Despite scientific and public interest in COVID-19 disinformation is an all-time high, little thorough study has yet to be published that systematically investigate belief in the virus misinformation and which of factors are most important in creating such views. Furthermore, McManus et al. Criticized existing studies that have been using low-quality convenience samples, while Ellington et al. Also pointed out previous studies failed to address systematic assessment of how deception about the virus can influx vaccination decision-making and compliance with well-being guidance measures. In addition, Rosengate urged the need to explore digital literacy which may impact misinformation is received, processed, and shared. Therefore, in order to optimize online vaccine communication, it's necessary to look at the process people receive, process, and share vaccine information when they search the web, as well as the impact of vaccine decision. So what is the significance of this study? From the view of societal, it helps to reduce the attitude of misinformation shared within the society and build awareness among netizens. Secondly, in terms of academia, it builds recommendation for public health communicators and it advances the knowledge in digital literacy. So, for this project, the objective of it is to test misinformation when received, processed, and shared on social media through factors of predicted sharing behavior on information without verification, and secondly, through information literacy on recognizing when information is needed and locating, evaluating, and effectively using the information. In terms of the literature review, before it becomes a misinformation, sharing information with users is necessary on social media platforms to survive. Misinformation is defined as incorrect information which is caused by a probable outcome of not knowing whether the information is correct. Moreover, Waddell and Derek shared on the unincentivized clicking on social media to view articles' origin, which will be shared unconsciously while not knowing the reliability of the information without harming anyone. From a health perspective, misinformation is a health-related claim for false accusation due to the lack of scientific data. Here, we'll be using misinformation in the term of mis and dis. This is due to the inaccuracy in information shared unconsciously, not knowing whether it's true or not true, and its inaccuracy of information shared unconsciously. Exposure to misinformation about the virus may be more common than often assumed. This is alarming from a pool of Ofcom in UK, which has almost half of its British population to obtain news regarding the pandemic from social media, a non-official platform. The most important public health intervention in the history and life-saving miracle. UN Secretary General making it clear that when there is a vaccination, there is a need to make it accessible for everyone and everywhere. Using misinformation, the drivers of these predictors have lower trust in science and scientists, lower trust in journalists and mainstream media, lower trust in government, as well as the role of political ideology, specifically in conservatism. A study using these drivers of 5 countries, which consist of Ireland, Mexico, Spain, UK, and the US, used an ordinary least square (OLS) linear regression in predicting the susceptibility to misinformation using average reliability judgment of 6 misinformation. It concluded on the linkage of susceptibility to the misinformation and vaccine hesitancy with likeliness in complying with public guidance. Knowing the impacts, it is crucial to study the social media's impact on misinformation when it's received, processed, and shared. In this study, verification behavior of individuals relating to independent corroboration signifies a person's effort to verify information through varying and disparate sources. Independent corroboration requires careful thinking and the presence of specific set of internet skills. In the framework, we have adopted TRA and TRB, which is theory of reasoned action and theory of reasoned beliefs, to understand the information of sharing behavior and perceived efficacy in recognizing misinformation. Using TRA's component consisting of personal attitudes, beliefs, social norms, and behavior intention, we can conclude that beliefs evaluates the consequences of their actions of behavior based on their beliefs to perform behavior that leads to a desirable outcome, and attitude is the outcome of the consequence influencing people's attitude to the behavior. TRB was formed due to the perceived behavior control added into TRA. This control originated from the self-efficacy. Perceived self-efficacy in recognizing misinformation, also known as PSERM, is an individual belief and attitude will guide one's perception of capacity to carry out behavior. This perception is called self-efficacy in developing TRA into TRB, in which self-efficacy is coined as perceived behavior control, and the mean to implement behavior will likely be high self-efficacy. Self-efficacy can be used to measure social media skills, the ability to successfully find information online and produce and consume the content. Self-efficacy are expectations that people hold on to the personal ability to perform behavior and concern with the capabilities to execute specific tasks. Self-efficacy can be used to measure social media skill, the ability to successfully find information online and produce and consume content. Self-efficacy are expectations that people hold up to their personal ability to perform a behavior and concern with the capabilities to execute specific tasks or courses of action. The ability to evaluate online information and accessibility, its reliability is important, and among other factors is determined by the content of the message. Moreover, people generally trust news from social media, although such trust varies by age, gender, and time spent on social media. Hence, we hypothesize that the individual's belief in information reliability will have a positive influence on perceived self-efficacy in recognizing misinformation, and the second hypothesis in the individual's attitude towards verification of information from social media will have positive influence on the perceived self-efficacy in recognizing misinformation. Behavior is influenced in different situations and contexts. Such attitudes can include the needed healthy skepticism of online information that could determine information verification behaviors. As such, we argue that the perceived self-efficacy is an important factor that can impact behavior associated with talking misinformation online. Here, perceived self-efficacy is included as an important factor that can can impact behavior associated with misinformation online. Hence, perceived self-efficacy in recognizing misinformation as a factor in understanding the reason for individuals who share information on social media without verification. In TRA, the behavior and attitude would lead sharing behavior without verification on social media. This hypothesizes that individuals' beliefs, information reliability will have a positive influence on sharing behavior without verification on social media. And secondly, individuals' attitude towards verification of information from social media will have negative influence on sharing behavior without verification on social media. Using schematic reason action model, beliefs are based on the individual, social, and information related to their background. Individual background here relates to the internet experience and self-esteem. Self-esteem refers to an individual sense of value or self-worth, or the extent which people value, appreciate, or like themselves. It is potential that can impact individual self-efficacy and online sharing behavior. Social background research includes age, gender, employment status, income, level of education, and social class. From esteems, assessing online health information suggested that demographic factors such as age and gender, besides knowledge of the content after perception of message credibility. Here, we propose an individual's background factors will influence perceived self-efficacy in recognizing misinformation, and individuals' background factors will influence the sharing behavior without verification on social media. Internet skills-related variables are also important factors that can predict and perceive self-efficacy in recognizing misinformation, as well as sharing behavior without verification. Previous research literature concepts internet skills to be referred as digital literacy and competency, calling it the 21st century skill, due to the enablance of a person to conduct everyday tasks in a social atmosphere. Hence, it is used to understand factors predicting an individual's behavior in sifting through information and to filter and differentiate misinformation from credible ones. In this study, information literacy includes information seeking, information sharing, and information verification. Information seeking skill is defined as the persuasive skill for information as a consequence of a need to satisfy some goal in seeking its meaning or extending a person's knowledge about COVID-19 vaccination. This is studied through looking at a person's ability to learn new information through reading online comments and the advanced skill via viewing on social media such as YouTube, Twitter, Facebook, and WhatsApp. This allows users to filter and analyze information here. Here, information access skills are obtained from the internet and training in the form of information literacy. This will create a positive relationship with information sharing and verification behavior on social media. Here, we propose two hypotheses. As for information sharing skills, the communication of information through engaging with content through writing comments, replying posts, favoring, or liking content. Higher order internet skills includes involvement in an online discussion. Here, we can view two of the hypotheses based on this. Information verification, on the other hand, means verification of social media information using online tools such as search engines to establish the credibility of information as critical evaluation skills. Here, we hypothesize misinformations are likely to be recognized through search engine, and this is hypothesized through this hypothesis. For data collections, Malaysia will be shared with an online survey on social media such as Facebook and Twitter with a sample of a minimum 300 through snowballing sampling via a link. This method is a quantitative through positivism approach in the scientific study. As for operational measures and skill reliabilities, measurements that will be used in this study are self-efficacy in Tier A and Tier B, and the elements of information literacy which would be used to analyze using SPSS 2.0. To investigate the behavior of sharing information without verification, belief in this study was operationalized into reliability information circulated on social media that is shared on social media by friends and other sources based on what makes them a trusted source. On the online survey, will be divided into three parts, which are demographic information of surveyors, predictor factors online misinformation when information is received, processed, and shared on social media, and the information literacy. To conclude, independent media fact checkers and users play an important role in addressing misinformation on the vaccine. Fact checkers can help to sort false claims from true materials and accurate ones from misleading claims. There is a need in addressing misinformation by discovering misinformation received, processed, and shared on social media through the factors of predicted sharing behavior without verification and information literacy as new variant strains emerge. With this, it is seen that it is crucial to mitigate the susceptibility of misinformation on COVID-19 in achieving SDG 3. Through vaccination program, it is one of the most cost-efficient methods in saving and promoting well-being and health. Based on Gavi's immunization and sustainable development goals, vaccination saves 2 to 3 million lives while protecting more from disease and disability. Moreover, it reaches more households than any other health services and brings the communities with healthcare systems which provide universal health coverage. Here, social media plays a big role in achieving herd immunity.